Okay, let's get right into it. Why do your hip and low back still hurt?
Sound familiar? You've done the PT, you've had the injections, but that pain is still there.
So, if you've done everything you were told, what on earth is everyone missing?
Maybe you even got an MRI and they told you, hey, everything looks normal.
Which, of course, leaves you wondering if anyone really knows what's going on.
Well, conventional wisdom usually points to a disc or your SI joint or just needing a good stretch.
But what if the pain isn't coming from any of those things at all? The real culprit is often something that's totally overlooked, muscles that have just stopped firing. We're talking about muscle inhibition. It's a signal problem, a disconnect between the brain and the muscle. We see this with huge, important muscles like your glutes, hamstrings, and deep core stabilizers. So it all starts with those key muscles just shutting down. Then your hip and low back start to hurt because smaller muscles are trying to do a big muscle's job. After that, you might notice your balance gets worse because those big stabilizers are offline. And pretty soon, every single step you take creates pressure in all the wrong places. This brings us back to the big question: why didn't those other treatments work? Well, it's because you can't stretch or inject a muscle that your brain has forgotten how to talk to. It requires a huge shift in focus, from the painful part to the entire system. The solution is neurological rehabilitation, basically turning those muscles back on by retraining the brain. And the really good news, when you get those muscles firing again, people actually start improving. So if you've been stuck in this cycle, the first thing to know is this: you are not crazy. Your pain is real, but it doesn't mean you're permanently broken. The problem is completely solvable. Your muscles just need to be retrained. So what if the real key to taking back control isn't in your body, but in your brain?